So diseases can occur in the blood vessels. There are two main vascular disease mechanisms. One of them being the narrowing or the complete obstruction of the vessel lumen, the other one being the weakening of the vessel wall. So when people suffer from high blood pressures, when you may have a viral or a bacterial infection, when you have a high amount of lipids, blood cholesterol, when you're smoking, it can cause endothelial cell activation. This increases the production of procoagulants and adhesive molecules, as well as pro-inflammatory factors within the vessels, as well as an altered expression of things like growth factors, chemokines and cytokines, which makes the cell walls much more sticky and attracts a lot more leukocytes. Therefore, endothelial injury is critical to the formation of thrombi, atherosclerosis and hypertension, as well as other vascular disorders, as this sort of sticky wall makes it more likely for molecules to bind to it and form thrombi and plaques. Initially, this sort of endothelial dysfunction can be reversible because it's in response to an environmental stimuli. So if the stimuli is removed, then they can revert back. So endothelial dysfunction is potentially reversible as it's caused by environmental stimuli. So they have the potential to revert back to the normal function. But with endothelial activation, there is alterations in gene expression and therefore protein synthesis. So this is harder to reverse. As well as endothelial cells playing a role in causing difficulties, the smooth muscle cells also play a role. So normally they allow for vascular constriction, so they go smaller, they make the lumen smaller, and vasodilation, so they make the lumen larger, allowing us to alter the sort of flow of blood. They're key in the synthesis of collagen, elastin and proteoglycans, as well as the production of growth factors and cytokines. But when vascular injury occurs, they can proliferate and migrate to different letters to the tunica intima, and they can sort of turn bad. So the overall result of vascular injury, it tends to be thickening. So the thickening of the wall, which can lead to stenosis or narrowing of smaller blood vessels, leading to a reduced blood flow.